This is the video on AVMs. An AVM is an arteriovenous malformation. They can be found anywhere in the body, but this video will discuss cerebral AVMs. An AVM is a tangle of abnormal blood vessels that connect the arteries and veins of the brain. In the AVM, the arteries feed directly into the veins without the intervening capillary system. The arterial side of the vascular system is high pressure, and the venous side is low pressure. The capillaries tend to significantly reduce the pressure of the blood in the arteries before it passes to the veins. With an AVM, there is no pressure drop, and the veins can become distended and thinned. This is a prime reason for the high rate of hemorrhage in AVMs. The size of an AVM is highly variable, from a few millimeters to extensive ones covering the entire hemisphere. AVMs are congenital, so they are present at birth, but the typical time for symptoms to appear is within the second to third decade of life. The AVM does not have normal blood vessel structure. They are thin-walled. The vessels feeding the AVM may become dilated over time, shunting blood from the brain into the AVM. AVMs tend to present clinically a bit different than aneurysms. Some people with an AVM close to the brainstem can hear a pulsating buzz when resting quietly. AVMs are diagnosed 20% of the time through an evaluation for chronic headache in a person. Up to 50% of people present with a seizure from the pressure and the shunting of blood from the brain. The rest present with a hemorrhage, either intracerebral, subarachnoid, or subdural. Small AVMs tend to bleed, while larger AVMs tend to cause headaches and seizures. The rupture rate of AVMs is 4% per year. So if a person is 30 years old, they would have a 75% chance of the AVM rupturing during their lifetime. If it ruptures, 30% of patients will die from the hemorrhage. 10% will survive, but with neurological problems, and 55% of survivors will be able to live independently. The treatment for AVMs requires some sort of intervention. The most common treatment is surgical removal of the AVM from the brain. Another form of treatment is the embolization of the feeding vessels. This can be done through radiology, placing a catheter into the feeding arteries and placing a coil to embolize the vessel, or form a clot in the vessel, preventing further blood flow into the AVM. Once all the feeding vessels are clotted off, the AVM is not at further risk of bleeding. Embolization is often used as an adjunct to either surgery or radiation treatment, as it reduces the size of the AVM and the risk of rupture during surgery. AVMs can be treated with gamma knife radiation. This is when a dose of radiation is given precisely to the AVM without significant radiation occurring to the rest of the brain. This takes a few treatments, and the full effect of the radiation may not occur for several years before the AVM is totally obliterated. During that time, the person is at risk for headache, seizures, and possible ruptures of the AVM. This ends the video on AVMs.